I'm going to talk a little bit today about the difference between herbal formulas and pharmaceutical medications. It's something that as an acupuncturist I get asked a lot. I'm sure there's a lot of confusion, a lot of misconceptions out there. A lot of the questions I get asked are something around the lines of, okay, so if these herbs are going to help with my sleep, but this Ambien is also going to help with my sleep, I don't really understand what the difference is. So I want to kind of dispel some of those myths for you all today. But let me, I guess, first give you a little bit of background about myself and why I became so enamored with herbs to begin with. I actually was working in the Western medical field. I had every intention of going to allopathic medical school. And I was suffering from very chronic, debilitating pain as I graduated. I used to be a gymnast, a lot of wear and tear on the body, and everything that had been done from the conventional model for me had not worked. I was at a point where I was 22 years old, working in the physical therapy field, and was getting lidocaine injections in my neck and back every 2 weeks just to function, just to be able to do my job. And I was feeling like the medical system was failing me a little bit. I had, studied really hard, had all these plans to go ahead with school, and was really trying to find my footing. I ended up having an acupuncturist who was working in the same practice that I was working in for physical therapy at the time, who offered to help. And a lot of my patients had gone to see this acupuncturist. I really didn't know a lot about acupuncture at the time, definitely had never even considered trying it before, but was really in a place where I was desperate and I needed some answers. And I was also seeing a lot of themes with my patients and patterns I didn't quite understand from the more conventional way of treating things. So I ended up going to this acupuncturist at that point out of desperation to get out of pain as a 22-year-old. And actually my first treatment, I got very sick. And it was shocking to me, and everyone says, well, if you got sick from the first treatment, why did you go back? Well, to me, I didn't think anything was going to happen. I thought it was maybe a placebo effect, or, didn't really understand how putting little needles in could possibly help me. And I went back to the acupuncturist. I told her what happened, and she said, oh, we just need to do some more grounding points. This was for shoulder pain and neck pain. There were too many needles up top, not enough down below. And again, it sounded crazy to me at the time, but I went with it because I was desperate. And after that second treatment, I was almost completely out of pain. And after about 8 more treatments, I was absolutely out of pain. It lasted. I didn't have to get injections anymore. I wasn't in chronic pain. And I thought, oh, there's really something to this. And at the time, the patient population I was working with, we would do these protocols for someone who had a knee replacement, an ACL repair. There'd be certain benchmarks that they should be making as a rehab patient. And I would see that not everybody was fitting into these molds and making these benchmarks. Even if we did everything from a physical therapy perspective, we could. So Chinese medicine for me became the thing that explained all of the unexplainables. So when I would have 2 patients who were both 35 years old and had the same knee surgery and were going through the same protocols, and one was progressing and one wasn't, even though they were in the same socioeconomic status, same age, same gender, I wanted answers for that. And Chinese medicine has this beautiful way of looking at the root cause of things and looking at, okay, how do we address the root cause to then heal these branch issues? So when we say branch issues, we're talking about symptoms. Now, symptoms to us can often be frustrating. Pain is a symptom. Often that's uncomfortable. We don't want to experience that. But all a symptom is the body telling us that something underlying is going on. And so traditionally, with a conventional Western medical model, you treat a symptom. So someone is having heartburn, we give them a medication to suppress the heartburn. And a lot of times the question is not asked, well, why did they have heartburn to begin with? Or someone has knee pain. We give them an NSAID, which is a non-steroidal anti-inflammatory drug, in order to get rid of that pain, rather than looking at the entire picture of, okay, well, so this person has knee pain. Is this actually a knee issue? Or is this something coming from the hip or the back? Is this something due to their lifestyle, the way that they're sitting on a regular basis? Maybe this is not at all the knee joints problem, where we're looking to attack with the treatment, and sometimes that progresses to, cortisone injections, and things like that, and that might not even be the root cause of what's going on. So what's very different between a pharmaceutical medication and an herbal medication, even though you might have the same result? So let's go back to the example of not sleeping well. If you get an herbal prescription versus a pharmaceutical medication, you might get better sleep both ways. But the way that we are attacking that problem is going to be a little bit different depending on which of those two roads you go down. So an example that I love when patients ask me, well, so what's the difference? Is it just the same thing? This is just a more natural way. There's fewer chemicals in an herbal formula. Okay, yes. But I want everyone to picture a runner. So someone who is running as fast as they possibly can, and it would be very easy to stop someone who's running, correct? So you see someone, no matter how strong of an athlete they are, even if you're tinier than they are, it's very easy to stop them. You could jump in front of them, you could trip them, you could throw something at them, you could, yell something to distract them. It's very easy to violently stop someone from running. On the other hand, think about someone who's being coached to run properly, okay? That's a longer process. That's something that is not as easy to do, to coach someone to run properly, but has a great result once we get it right. So this idea of stopping someone from running is very similar to how a pharmaceutical medication works. So it's not always addressing the root source of the problem. It often is very fast acting, so you can't sleep. Taking an Ambien, you're going to be tired and you're going to go to sleep. We're not addressing with a pharmaceutical medication like Ambien the root cause of why you have insomnia, which could be, you're stressed. It could be that your cortisol is out of whack. It could be that you are constantly looking at your screens before bed. It could be that you're not in a great living environment, and too much sugar before. There's countless reasons of why the body's gotten conditioned to not sleep well. So a Western medication is going to be very fast acting, just like that runner that immediately is shut down from running. It's a quick and can be painful for the body. There's a possibility of side effects with that. So if that runner, is tripped and they fall, there could be injury with that, but they have stopped running. So that response in the body has been shut down. That response that's, oh, I'm staying up at night when I shouldn't be up, we're shutting that down, but not addressing, okay, the root cause of what's going on. Herbal formulas, some of them can be fast acting for some symptoms, but for the most part, they're going to be a little more gentle, a little more mild, and take a little bit longer to work. And this initially can sound frustrating, or, well, why would I want to just do an herbal formula then if I could have a faster response with a pharmaceutical medication? Well, with an herbal formula, you are working with the body's own unique physiology. So what does that mean? That means your body, will go back to the runner, innately wants to run. You want to run correctly. The body knows how to heal. It knows how to do things properly. So to coach someone to run does take a lot longer. You have to teach them proper form. You have to get conditioned. But we're not shutting down anything with herbal medications that shouldn't be shut down. So that's also why you have a much lower risk of side effects when it comes to herbal medications. With an herbal formula, it can be highly customized to you as an individual, and it's going to help support your body in doing what your body already knows how to do. Your body is very intelligent, already knows how to heal. It just often needs a little bit of a push in the proper direction. And that's the gentle support that you would get with an herbal formula. What I do want to say, though, in regard to that is herbal formulas and single herbs work very differently. So you'll hear a lot of times about a single herb, let's say, okay, echinacea, because that's very popular with the immune system right now. With echinacea, you always hear it's good for the immune system. Let's take some echinacea to boost our immune system. It's a single herb. That is going to help with one highly specific part of the body in order to boost the immune system. That might not be ideal for you as an individual, because if we are in fact talking about root cause and not just symptoms, low immune function is a symptom of something going on underneath. So everyone needs something a little bit different to boost their immune system, to help support their system optimally. So with this, herbal formulas are mixed in such a way that you have a combination of many herbs, and it could be anything from 2 herbs to 30 herbs, and they're all done in a very specific way where there are ratios and there are dosages, and there are instructions on how to treat them based on you as an individual. So my partner and I both want to work on our immune health at this time. We are taking 2 very different formulas because we both have our own unique physiology, our own underlying conditions that need to be addressed. And this really is the importance too of not letting little things with your health fall by the wayside during this time when we all want to be really mindful about what we're putting in our bodies and how we're taking care of ourselves, right? So we have to remember we are unique individuals, and although there can be some benefit from these awesome formulas that are marketed as immune boosting, or stress relieving, or good for sleep, you run the risk of not getting an optimal result if that's not customized for you as a person. And we have to remember where herbs came from and how medicine traditionally has been implemented. This symptom approach in Western medicine with pharmaceutical medications is relatively new compared to traditional medicine that's been around for thousands of years. And that doesn't mean that we can't integrate the two, because it really all should just be medicine, period. Integrative medicine, that's what people need. There are times when you're going to need a pharmaceutical medication, and thank goodness we have that available in our healthcare system. But there are also plenty of times when an herbal formula would be very appropriate, and it's about what's best for you as an individual and what you need. So to really identify those needs, I always recommend going to someone who is licensed and can help be an incredible diagnostician to work on your underlying issues to help you function optimally. So as we go back to what I was saying about where did herbs come from, how was this medicine traditionally implemented, it was a complete system of medicine. Eastern medicine, I'm a licensed acupuncturist, I do herbs, I do nutrition, I help people with their day-to-day lifestyle activities that could be causing damage to their system. It's a complete system of medicine. So then as time went on and other medical modalities came into play, we've been trying to figure out, okay, how do we all work together and integrate? Looking at how this was traditionally implemented with herbs being so customized, I learned a baseline of 400 plus herbs when I went to school for Chinese medicine. And then on top of that, all of those get combined into different formulas. So you can imagine the infinite potential of working with herbal formulas, and how you could get quite a variety of results based on how this is implemented, right? So that's why I say it's amazing that we do have these companies who are making herbal medicine more available to the general public, particularly at a time right now where people need as much help as possible. But it's important to be mindful about, okay, how is a pharmaceutical medication working? How is an herbal medication working? And am I getting these from the proper source? So as a licensed acupuncturist, I don't prescribe pharmaceutical medication. If I think that that's necessary, I will refer a patient to an allopathic medical doctor who I would work with to make that happen. But with herbal medication, I want you guys to remember that it is supporting your body 100% to do what it already knows how to do. So whether that is, I'm stressed on a day-to-day basis, and I think this is affecting my cortisol levels, or you've done a test and your cortisol is being affected, whether it's, okay, I have a food sensitivity and my gut is a mess, migraines, fertility issues, all of these different things are things that we could treat with herbal medicine, but it's not going to be a situation where you're going to turn around and tomorrow that chronic issue that you've been experiencing for 20 years is going to be gone. And that's also a misconception with taking a dosage of a pharmaceutical, is that you might not be feeling those symptoms anymore taking that pharmaceutical medication on a daily basis. So you think like, oh, this problem is gone. But the problem is not gone. The symptom is gone because we are utilizing a synthetic source to get rid of that symptom and tell your body, don't pay attention to what's going on underlying. Whereas with an herbal medicine, it's not going to be gone the next day. Even dealing with pain, you might have less pain the next day, but we still want to work on the source of what is causing that pain. And what's really incredible about using herbs in this way and understanding that it is about that runner who's learning to run, who is being coached at this time. It does take a little bit longer, but that's what your body innately wants to do. Your body innately knows how to heal, wants to heal, and we want to be able to support your body to do this in the healthiest, most natural way possible. Because with all of the incredible innovations that we have gone through, at the end of the day, our body is still the smartest thing. We all know our bodies. We have the ability to tap in with our bodies, see what's going on. And if we aren't addressing that root source of what's happening, we're really doing a disservice and fighting against ourselves. That being said, not everyone on here is going to have immediate access to a practitioner like myself or someone in your state or your area in the way that you would ideally like to. I'm offering telemedicine at this point for anyone who is interested in that customized approach for patients in California, and I have a lot of colleagues in other states, other countries that I would love to refer you all to as well, if that's something you're interested in. But I think there's also something to be said for the basics and staying healthy at this time. So whether you are on a pharmaceutical medication that's trying to address something, whether you are on an herbal formula, there are some basic things that I think everyone needs to be really mindful at this time, particularly because, like I said, your immune health is only a reflection of how healthy your overall system is. So plenty of hydration. And this has been around a lot in the news because people are saying, oh, if the virus is in your throat, then you swallow it, it goes in the stomach acid. Yes, there are plenty of very specific benefits to drinking water, but you have to think that drinking water also is what your system is majority made up of. So we are giving you the foundational tool of hydration to help your system function well. Also sleep, because whether or not you all are feeling run down right now, you're feeling sick, maybe you're not, you just want to stay healthy, your sleep is the time when your body can recover at its best. I wish all of you could have needles in you right now and you could be recovering during an acupuncture treatment, because studies have shown with that you get even more recovery benefit, getting an acupuncture treatment for 30 minutes than napping for 30 minutes. But you need to take that time to let yourself recover. And even if you're thinking, oh, I'm not going out, I'm not susceptible to anything, I'm feeling pretty good right now, the stress of change is a very real thing. So there's, that damaging physiological stress, and then there's eustress, which is the positive stress that keeps us motivated. And I think a lot of us are trying to have that type of stress right now, and that's a great thing, but there's still a physiological response that happens to the body that we want to make sure we're addressing and taking care of. And having good quality sleep is going to be very important for that, to help heal any damaging effects on the physiology that you've had during the day. That's going to be taken care of during sleep. And also, we have the incredible ability to make choices at this time with what we fuel our system with. I'll talk about food in a second, but when I say fuel your system, that is all your senses. So what are you exposing yourself to when you watch TV? Who are you talking to? Are these people that are on the same wavelength as you, who you'd want to surround your future self with? What's going in all of your different senses are things that we need to be mindful of at this point. And when a lot of people are isolated right now, that's a really great opportunity that we have, because we have even more of a choice than we would normally do about who we let in and what we're fueling our senses with. That being said, nutrition is something we're also fueling our body with, right? And I think it's very easy to fall into this trap of, we have to hoard everything and we want to take all the processed food off the shelves, because what if we don't have food in X amount of time? And there's a lot of fear that goes along with that, which I can understand, wanting to have reserves and a backup. But if you go to a lot of stores, there's still produce, and there's still meat, there's still a lot of good healthy food that we're missing out on. So it's fine to have the reserves of the things that will last a long time, but maybe in our day-to-day, it's great to incorporate things that will give us the biggest bang for our buck. When you take a bite of food, you are either fighting or fueling disease. And trying to stay as healthy as possible, that's a dose every single bite. So think of the power in that. When I see a patient in my office and I tell them, okay, so you're seeing me 1 hour today for this acupuncture treatment, but when you leave the office, what are you doing in the other 23 hours of your day? And that's something that we have a lot of control over right now in a world where it seems like we have very little control of things. So remembering to go back to your basics, your water, your sleep, your de-stressing, what are you fueling yourself with, what foods are going in your body. And something I want to offer all of you is I do have a free downloadable PDF that I made for anyone who needs it at this time, and it's specifically about the best foods to have right now to help your immune system. It's available on my website, which I will put in the comments below as well. It's PiqueBH, like Beverly Hills.com, PiqueBH.com. I want everyone to take advantage of this because it is about the basics, and we can certainly do more to customize all of the approaches that we talked about with herbs to you all as individuals, and I think that's amazing. And if you can take advantage of that opportunity, please do. But for those who can't, we have to do something to help everyone. It's about providing value at this time. So please go ahead, visit my website, download that PDF about the best foods to boost your immune system. I'm available to answer any questions you guys have. This will be posted on the feed. So I'll make sure to check back and answer any questions for those of you who missed this. But thank you guys so much. I don't think I missed any questions. And have an amazing rest of your day. And thank you to our amazing founder of The Circle for the invite as well. All right. Bye, guys.